Hello and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. Now, if you remember when this whole COVID-19 thing first started, everybody was saying that it's a white person's disease. It's not going to happen to the black people. We're blacks, our genes are different. We're going to do much better. But then the picture began to change, and we started seeing, especially in the Western world, we started seeing a lot more black deaths. In fact, blacks had by far the greater number of, they had a greater proportion of deaths from among black people than amongst the other races. In some cases, 4 times the number of white people were dying from COVID-19. And then it began to change again. And then, and then when we started looking at Africa, and when we saw this thing was coming to Africa and to Nigeria, everybody was saying, oh, Nigeria is just going to be taken apart. It's going to spread like wildfire. Who was it? Was it Melinda Gates who was talking about how they're going to be seeing black people in the streets dying, lying around in the streets? But interestingly enough, that didn't happen as much. As a matter of fact, we began to see a almost milder version of the condition. It just seemed like many people who are not doing all the things, the social distancing and the hand washing and all that, were seeming to have, even when they contracted the virus, they just seemed to have milder cases. Now, that's not to say that there were no deaths, because there certainly have been deaths, and it's over 500 now, close to 600. And of course, if you've been affected, you have a loved one, you've lost a loved one, our condolences go out to you, our hearts go out to you, and we hope that it does not progress. But it hasn't been as dramatic as had been proposed earlier. But still, we're now seeing another picture, especially in the northern states. Lagos has always been bad, the worst in the country, but we're seeing places like Kano and other states beginning to arise, and we're seeing what is termed mysterious deaths, which we now know is more like 50%, they say, is actually due to COVID-19. So we want to take this a little bit more seriously. The purpose of this show, this current episode, really is to take a closer look, both from the inside and from the outside. And on the show, in the studio with us, is shall we say, a good friend. I've known him for how many years now?
About 10 years.
About 10 years. Dr. Chris Otabo, ladies and gentlemen. He is a consultant orthopedic surgeon in the FCT region, and has been actively involved in the whole COVID-19 thing. And as a matter of fact, he is also an ex-patient.
Yes, thank you. I'm an overcomer. I don't like the word survivor. because I mean, if you had malaria and you got treated and you got well, you don't say you're a survivor of malaria.
Yes.
But that's where this whole thing is going, because it's not going away soon.
It doesn't seem to be.
Yeah, yes.
It doesn't. We thought it was beginning to be under control, but it's taking a different turn altogether.
We are in for a marathon, really, not a sprint.
Oof.
Yes. So everybody should get ready. Yeah.
All right. So we're going to talk about a lot of things. Some of the things like, okay, what is the current state of the nation? How we're treating COVID-19? Some of the shortcomings you are seeing, especially having seen it from both angles. The presentation, I also want to talk about the presentation. I mean, what the differences we're seeing among these COVID-19 patients as opposed to what we see in the US or the other way, the Western world. And then some of the drugs that are being proposed these days. And also some of what we can do from a local perspective to strengthen ourselves, strengthen our, the whole thing about boosting the immune system is a catchphrase now. But I'm really glad that you're here in the studio today, because I think we can share a lot of insights.
Okay, thank you very much. Let me start with your opening shot concerning the differentials between the West and Africa in terms of the number of cases, the severity, and the death rate.
Yeah.
One thing that is obvious in Africa is that we have a very young population.
Yes.
And on the average, life expectancy is somewhere around 52, 54 years.
Yeah.
Compared to some of these Western worlds that have, Western countries that have life expectancy upwards of 78 years.
Mm-hmm.
So, and you know that COVID-19 decimates the elderly population more, because also the older we get, the more comorbidities are likely to be with us. Diabetes, coronary heart disease, stroke, cancer, and so on and so forth. So, and if you look at the pattern of deaths in the West, it's more with these elderly ones. So that's one of the reasons why it appears to be more severe in the Western world, in US, Spain, Italy, and all that. Italy is known to have the oldest population in the world.
Oh, really?
Yes, so no wonder their death rate was that high, and the severity rate is also high. Secondly, too, people are looking at what Africa has gone through over the years, tuberculosis, malaria, and all that. So it's been postulated that somehow, because of the disease burden, some resistance, some immunity have been developed that might be preventing it from hitting us very hard. But everything is still at the level of conjecture. Nothing is proven. But the one of the population age difference is valid.
Right.
And that can explain why the death rate is not that high.
Do you think the climate, having been exposed to more sun, may be a factor too?
Yeah, people used to think of the climate until when it hit Brazil. Yeah, because Brazil is a tropical climate like Africa.
Right.
So the wave is the stuff seems to be going in waves. Yes, it hit China, from China to the US, Europe, and now it's in the South America. And the death rate there is so high now. The number of cases
second to the US.
Yes. So if you say climate, I mean, Brazil is tropical climate, and so are we.
Yeah.
So if it could hit them there, then there's nothing that stops it from coming here. If we're looking at climate as a singular factor, but I think there's a number of factors. But nevertheless, I think that the problem of COVID-19 in Africa, and Nigeria particularly, is highly underestimated.
Are you referring to denials or to the level of, because I think the government seems to be actively on it. Or what do you think?
When I say underestimated, I mean the level of testing.
Okay.
If you are not testing enough, you will not find the cases. And the number of deaths from COVID-19 is grossly underreported. Yes. For me, I think that based on my experience and my interaction with people, I think that the number of confirmed cases is far less than half of the number of total cases. Yes, in fact, if I say less than half, that's generous. We're probably picking up about 20% of all the cases.
Wow.
Yes, because Nigerians are living in denial. When they have symptoms, they choose to stay at home. They don't want to be labeled COVID-19. They stay at home. The only people that are forced to go out are the ones who are already dying now because they need help. But every other person chooses to stay away. So the NCDC is trying to do contact tracing, but people are not cooperating that much. So they are not going to come out for you to test them. If a member of the family gets sick and is well, or he recovers, for every one person that recovers, there are probably 10 other people who are not showing up for testing.
Even when they call them, I understand. Even when they call them,
yes, when they call them, sometimes they just relocate or block the lines or stuff like that. So what?
It's not my portion.
You know what baffled me in all this? It took the grave diggers and the cemetery workers to announce a pandemic in Kano State.
Are you serious?
That's how low we got.
Are you serious?
Yes, it was the cemetery workers and the gold diggers, the grave diggers that raised the alarm. they raised the alarm to say, look, we are seeing more bodies being brought to be buried. That was how...
Than usual.
Yes, that was how people's antenna were raised, and the epidemiology team went, and doctors started talking. It was the grave diggers that raised that, and that's the last point in terms of the response to epidemics.
It should be.
Yes, but they were the ones that raised they sounded the alarm before the team from the Federal Ministry of Health was sent there, and they confirmed that 50% of those cases were actually COVID-related based on oral autopsy and all that.
Goodness.
But you know that those numbers are not on the NCDC list because it was not confirmed.
Goodness gracious. All right, folks, we will be right back to talk more about what's happening in Kano. Stay tuned. All right, welcome back. All right, so we've been talking about the case in Kano and what Dr. Tabo said about grave diggers being... That is tragic.
That's the reality.
For the grave diggers to be the ones to announce that there's a pandemic means that there's a problem.
But that's actually what happened.
Goodness gracious. Prior to that time, the powers that be, so to speak, were saying that there was no problem of COVID-19.
Yeah, they were living in denial. I mean, when the WHO announces a pandemic, that means that it's gone beyond one or two countries. It's all over the world. Mm-hmm. And because of international travel, this thing will go around. Mm-hmm. And it was already discovered in Nigeria, 27th of February. Mm. So every state ought to raise their antennas, and the epidemiologists ought to start work immediately. It's a case that every collection of symptoms that point towards COVID should have been reported immediately from the hospital level, community level, primary health care center level, and then documented.
So you're saying that means that the doctors in Kano State, for instance, were treating these patients and they were not...
That's why a lot of doctors became positive, because they were unsuspecting. So a lot of doctors got the infection in Kano, because when people are severely sick, they will go to a hospital. At that time, they didn't even know that there was COVID-19 and the stigma was not there. So when they go to the hospitals, they treat them like any other pneumonia, and then they die. They send them to the grave, for burial.
And that patient is exposed.
Yes, the doctor is exposed.
The nurses, yes. The co-patients.
Yes.
Okay. Other than Kano State, are there other states that we should be particularly concerned about?
Yeah, of course, like you said, Lagos has always been the epicenter, and I am so impressed with what Lagos State is doing. Despite the fact that the cases are rising in Lagos, but they are true to themselves, and they are bringing out the true picture, because it's only when you identify the problem that you can solve the problem. But some other states are living in denial, and when the shit hits the fan, it's going to be bloody. You know, there are two states that I think that the federal government may have to take responsibilities for, and that's Cross River State and Kogi State.
Why do you say that?
Yeah, because I don't know what these two governors are trying to achieve by their grandstanding about the presence or absence of COVID-19 in their states. People are dying, cases are being reported, and yet they keep arguing so vehemently that there's no COVID-19. The presence of COVID-19 in your state is not a sign of weakness, and it's not a sign of failure. I mean, the whole world is in it.
Right. Exactly.
And the absence of it does not also give you any political points or make you a sort of hero. On Sunday, the chief judge of Kogi State died, and it was reported that it was COVID-19 confirmed. And he left Kogi State to come to Abuja for treatment because they are living in denial there. 2 weeks ago, I got a call from a member of my church who said the father was critically ill, having all the symptoms, COVID-19, respiratory distress, fever, cough, and catarrh. But they could not do the test because the administration in that place has blocked them. They are talking of antigen test, antibody test. Those are rubbish. There are standard ways of diagnosing COVID-19. So if you refuse, thank God for the Federal Ministry of Health now that have bypassed the Cross River State governor and has set up a testing center at the University of Calabar Teaching Hospital. And that University Teaching Hospital has come out to announce that they've successfully managed and discharged at least one case of COVID-19. But I can tell you that there are many more.
So is the testing facility in Calabar, is it bringing up positive?
Well, I don't know what it is at the moment, but at least they've made progress in that direction. But when you say, when NCDC officials get to your state, you will quarantine them for 2 weeks and stuff like that. It's just, I mean, it's annoying, you know. Yes, and I thank God also for the NMA in Cross River State who calling out the governor saying, look, you know, the consequence of this kind of denial is that you put doctors and other healthcare workers' lives at risk.
Absolutely.
Yes, you put it, I mean, this is serious. And I want to encourage the NMA in Kogi State to do the same and call out the governor and insist on doing the right thing. Otherwise, the healthcare workers are at risk. From the PTF announcement last week, I'm sure of that of Cross River State. And I think that is the reason is because the University of Calabar Teaching Hospital is a federal institution over which the governor does not have oversight. Yes. But Kogi State, I'm not aware of any federal institution. I think most of the health centers there are state-owned.
I see.
So they may not be able to come in. You know, even the Benue State University is state, the specialist hospital is state. So I can't remember if there's any federal institution. Because if there was, that's where the Federal Ministry of Health would have, you know, gone through to establish a presence there.
So why do you think there's this reticence, this resistance to this? And by no means, I don't think these are the only two states that have this attitude. Well,
the resistance at the level of political office holders and some people in authority is, I don't know, they've bought into some of the conspiracy theories, and it's telling a lot, even on the acceptance by the population, because a good number of people in those states believe their governors that there's no COVID-19 in their states, and that they just feel good about it, whether it's true or not. But generally, as a country, based on my interaction and reading from social media, comments on social media and TV interviews and all that, I see that there's a general skepticism about COVID-19. People think it's a scam. People think it's a fraud, that it doesn't exist, that they just want to use it. Some think that they want to use it to create an avenue for vaccination, you know, with all the evil agenda. Others think for Nigeria, COVID-19, they are using it to make money. Yes. But the reason for this, I've been trying to study and to see what's going on. And I found out that the COVID-19 situation in Nigeria is not properly communicated. So there's a communication problem.
Absolutely, I agree with that.
You see, I have interviewed people and I asked them, do you think COVID-19 is in Nigeria? They say yes, but it's not the serious type. I said, do you think it's in the US? They say yes, it's in the US. It's obvious that the one in Nigeria is a child's play. but the one in US is serious. What's the difference? I tell you the difference. The media in the US and in Europe were able to communicate the severity. They were able to communicate to the people. They had their cameras go into the intensive care unit. They focused on people who were fighting for their lives. Some survived, others did not survive, unfortunately. They went to the war zone to cover the war. Now, if there is a war going on in Nigeria, God forbid, and let's say the battle line is somewhere in the north, like you have Boko Haram now. Those of us in Abuja, we never know that there's a war except pictures or videos come out from there. Because you will never hear a gunshot, you will never hear a bomb blow, or, go off. You will never hear the artilleries. So you just feel everything is fine. But you need the communicators, you need the media to bring out the pictures. And what kind of pictures are Nigerians seeing about COVID-19? We go to the isolation centers and we see people taking selfies. You go to the isolation centers and you see people dancing all sorts of dance, playing Ludo, and just generally having a good time, calling and continuing with their business as usual at home and so it doesn't paint a picture of a severe situation.
Yeah.
So people say, oh, well, wait a minute. Did you say those guys there are COVID-19 patients? Then this is a joke. The problem is that we have not been able to capture the severe cases.
It's only when high profile, when we just hear of high profile deaths.
And all you hear is that the person died.
Right.
So the question is, why are they not doing that? A few reasons, but the main reason is because the severe cases don't find themselves to the hospitals. The severe cases don't have the opportunity of being treated. Because with COVID, the hospital system believe and they know that there's COVID-19. And so when they see symptoms that looks like COVID-19, they shut their doors. They don't allow them to come in. So people move from one hospital to the other, and then they are in respiratory distress. Some of them die in the ambulance. Others are returned back home and they die at home, and so on and so forth. And so because of that, you don't have the opportunity of managing the people. And it's what is available in the hospital that the press will cover.
Exactly.
Yes.
Exactly.
Yes.
I think we're going to need to pick up on that some more, because I think that's really, really important. We got to talk about what to do with the severe cases. Because if the private hospitals aren't being allowed to treat, from what I understand, and the public hospitals are turning them away, then we have a problem.
Yeah.
All right. So, folks, unfortunately, our time is over now. We're going to continue with Dr. Otabo in the next episode. So please stay tuned and watch out for our promptings on social media. Thank you for joining us. Remember, stay safe. You've got to do the basics: the washing of hands, the social distancing, using of masks. But over and beyond that, there are other things that you need to do. So be sure to join us in our next episode. Till then, God bless and stay safe.